you mentioned the old school generation.
Yeah.
I was at ACOS and I can't remember who I had this conversation with, but they were essentially saying that I don't know if it's political correctness, but in today's day and age, people go up on the podium, they give a presentation, and everyone says, "Oh, that was great, you were the best," and you get a lot of applause. And back in the day, it was not uncommon if you went up and presented to be on the spot, directly challenged. Like if someone didn't agree with you, they would call bullshit on the spot, and there was maybe not a lot of this positivity and warmth and friendliness and niceness, and it was a little bit more cutthroat. Were you ever in that world? Did you ever see that firsthand?
You know what? I never really, thankfully, haven't been challenged that much on podium. I think I sort of navigated I guess, more friendly times. I think there's been a few times that's come up, and it's interesting when it does. You tend to remember it, and you remember forever who challenged you. And then sometimes now I find myself as being one of those doctors that sometimes challenges the young doc. I feel like I'm this mid-career and seeing the younger guys come out and presenting something, and it is interesting. Somebody might present something that touches a nerve. I'm like, wait a minute, that's not quite right. Now I find myself chiming into the microphone and maybe trying to challenge them on the spot. And I think back, I'm like, maybe I should have just bit my tongue. I don't know. So anyways, I guess, but with all that being said, I think if you can do it in a tactful way, with respect, I think it makes those live meetings more interesting. I think, to me as an observer, there's nothing better seeing a little bit of controversy and seeing a little bit back and forth. And I guess what I can always respect is when there's two individuals that have passion for the field. They might have passion in different ways or might have conflicting thoughts, but you always have to respect that they're at least raising their hand, putting their thoughts forward. You might disagree with it, but you can at least respect their passion for sharing their thoughts.
Yeah, I agree with you. It's definitely entertaining, and I don't know if it's like the side of me that enjoys like seeing trolling in real time, or when there's controversy or bickering or arguments. It's definitely, if it's an otherwise sort of boring meeting, it certainly makes it a little bit more exciting. But I think at the end of the day, it's people, again, like you said, who are passionate about something or they have clinical experience in something, and now they're having a debate. Well, that's when you have a conversation, that's how you elicit what's right and wrong, what works, what doesn't work. And that's how you learn ultimately and then push things forward. So, I do think it's interesting. It is kind of boring, those meetings where people just go up and talk and then there's no discussion afterwards. And it's like, now you're 10 talks in and it's just like you're ready to get out of there, go to lunch, and the meeting runs from 8 a.m. to 6 p.m.
Yeah.
Maybe you've heard all these talks before at other meetings. And I find the best ones are when presentations are short, concise, maybe it's a little bit higher level, targeted to whatever the audience is. And then there's people who either don't have any experience with that technology or surgery, and then there's people who do have, and there's people maybe who don't like it, and they all kind of weigh in and give their different perspectives. I think that's the benefit of going to the conferences, especially if they're non-CME, right? Because that's when you can have candid conversations, and that's when really the real experiences come out. And sometimes learning remember we were at, I think, what was the meeting we were at? New Orleans.
Yeah.
It was you, me, Rob Weinstock, Blake Williamson, and there was a conversation around certain IOLs. Yeah. And Rob turned to Blake and said, that was worth the price, like in the time of coming here to this meeting, just to hear your little pearl about what your experience has been in practice,
Great point.
So it's things like that where even if you can just take away something like that, you talked about how some little inefficiency or misstep in a large practice can really affect things. That sort of goes back to that concept we were talking about, high volume, revealing all.
Right.
Gaining one little pearl like that, I feel like can make such a world of a difference.
Yeah, for sure.
Yeah.